Hello, and welcome to Health Matters, a show about health issues and interests facing our community. I'm your host, Gilda Kramer. I'm a Lower Merion Township Commissioner, and I chair the Board of Commissioners Health Committee. Today, we're going to talk about health services available to Lower Merion residents. My guests are Elizabeth DiArcangelo, who is the administrator of the Office of Community Connections at the Montgomery County Department of Health and Human Services. Shaun, Essex, the Regional Vice President for Administration at Mainline Health, working with Bryn Mawr Hospital and Paoli Hospital, and Brandon Trombetta, who is the Executive Director of ElderNet of Lower Merion and Narberth. We're lucky to have tremendous support from the county, outstanding medical facilities, and nonprofits dedicated to helping our residents. I'd like to start by talking with Elizabeth DiArcangelo about the Office of Community Connections. Ms. DiArcangelo, can you tell us what your office does?
Yes, and first, thank you very much for having us. It's a very important topic, so I'm glad to be able to present, all that we do for the community. So I oversee the Office of Community Connections at the Montgomery County Department of Health and Human Services. We were created back in 2013 as a way for the residents of the county to best learn about the services and many resources that are available to them for a wide variety of things. Mostly related to health and human services, which is where, why we belong under that umbrella for the county. But there's a whole host of other resources provided in the community that go above and beyond what the county provides. So we are here to help direct people to the resources that they may need and are unaware of, and help them navigate that complex system of providers in the community.
Well, how exactly do you help them navigate the variety of services that are available to people?
So each contact with a resident is really tailored to what is happening for them or their family, or even a close neighbor or loved one. So we speak with them about what's happening for them at the moment. They'll tell us the story of, what their struggles are, what they're challenged by, and then it's up to my staff and the advocates to help match them with the resources that will best fit those needs. So oftentimes there's more questions that we need to ask and do a little bit more probing to best understand their situations and their scenarios so that we know the best resources and matches to make for them.
Well, who are the people who are the navigates who help the residents?
So they're called navigates, and it's a clever play on the words of navigate and advocate. So again, the navigation comes in when people are contacting us about their needs, and we're helping them to navigate the very complex and overwhelming sometimes system of resources in the community. The advocacy part comes in. Sometimes an individual may be receiving services already, and there's a lot of times there can be miscommunication about the type of service they're receiving. So sometimes the navigates will reach out to that provider on their behalf and talk to them about some of the difficulties they may think that they're having. Sometimes we do need to kind of troubleshoot a little bit and make sure that the services that they're getting are the best fit for them.
Can you give us some examples of the types of issues that the navigates assist residents with so we can understand what you do?
Sure. I mean, there's a whole host of things that fall under the Health and Human Services umbrella, from addiction to healthcare, maternal and child infant care, mental health, behavioral health services, veteran services, public benefits, nutrition, other types of socialization and support programs. So for example, someone could call us about a housing issue. They're struggling with affordability, maybe they want to relocate, it's not a good fit where they're staying, maybe themselves or a loved one is struggling with a behavioral health or addictions issue. We have folks who are struggling to live independently in their homes, whether they're a senior or someone with a disability. We can refer them to resources to either help them live independently in their home, or maybe they're looking for care outside in a facility. Healthcare is a huge one, especially coming off of the pandemic. People are kind of struggling to get back into what they were, how they were living prior to the pandemic. So there's a variety of other things, including supportive services, as I mentioned, in the home, public benefits that they may not have been receiving prior. There's teens and young adults who are contacting us again. They've struggled with their education. They could be transitioning into young adults, and they're looking how to grow a career. So there's a whole variety of things that we can help with.
So how can somebody ask for help if they need it?
Well, we're pretty accessible. We are located in 4 different county offices, and we are back in person. So if someone does choose to come in and work with us in person, we are available for that. We have one main phone line that will connect a person to the closest regional office. We do receive a lot of phone calls, so we're very open and can help people by phone in the same way as if they'd come into us.
I just wanted to know what that phone number is that people can call.
Sure. Our main phone number is 610-278-3522. And from that main number, you would just select the regional office that's closest to you, and you would be connected to the advocates there who are really the experts in the resources in your community.
And how can you ask for help online? You started to say before that you can request help that way as well.
Sure. You can go to our Montgomery County page, which is www.montcopa.org/community connections. And we have a form off of our homepage that says contact an advocate. You can fill that out with your information and how you would like to be contacted, whether it's email or phone, and we can set that up and reach out to you.
Is there any charge for help from Community Connections?
Absolutely not. We are free. You can call us any number of times you like. And you don't have to be a resident in Montgomery County either. So oftentimes we get calls from family members outside of the county or even outside of the state who have loved ones here that they're struggling to support from a distance. So they will reach out to us as well.
The county has been offering COVID-19 testing and vaccinations. Can you tell us about the county's vaccination program and particularly its program to deliver vaccines to people who are homebound?
Yes, absolutely. I mean, everyone is very familiar with the fact that the county has been operating a number of vaccination sites, as well as a homebound vaccination program. So if you know of someone believes that they would qualify for a homebound vaccine, they're welcome to reach out. Our Office of Public Health has a phone number, a hotline, free to call at 1-833-875-3967. And from there, they will be connected to the Department of Public Safety, who will do that screening and determine if they will qualify for that homebound vaccination and set them up with an appointment to come out to them.
Well, that's really wonderful. I know that that's been a subject that I got many questions about earlier on during the pandemic. I'm sorry that we're going to have to interrupt our conversation, but we're going to have to take a break. We'll be right back with more about health services on Health Matters. Stay tuned. Welcome back to Health Matters, a show about the health issues and interests facing our community. I'm your host, Gilda Kramer, a Lower Merion Township Commissioner and Chair of the Health Committee. We're talking about health services available to Lower Merion residents. We're lucky to have Shaun Essex from Mainline Health to tell us about the health services that Mainline Health offers. Mr. Essex, how long has Mainline Health been serving our community?
Well, definitely, and thank you for having us on today, Gilda. So the Mainline Health System was formulated back in 1985. So started out between Bryn Mawr Hospital and Lankenau Medical Center, and now represents 5 hospitals in our area. And more particularly, what I'll be focusing on today is our Bryn Mawr Hospital campus. Now, Bryn Mawr Hospital has been a part of the community for over 125 years. I think about 128 years to be exact. And so Bryn Mawr has been a very much a pillar of the Bryn Mawr community. We're licensed for over 264 beds today. About 1,700 employees, over 900 physicians are part of our medical staff, and have been serving the community hopefully in a multitude of ways since that time.
What are some of the highlights of the services that Mainline Health offers?
Sure. So I'll focus on a couple of areas. We're very proud to have a very regionally renowned neurointerventional suite and lab for neuro services. So when you talk about stroke care, one of the primary places that I would say if you need it, you would definitely want to hopefully seek out our services if that's necessary. We also have a very strong partnership with AI DuPont and Nemours with a pediatric emergency department as well as a pediatric unit here on our Bryn Mawr campus. We have also a comprehensive bariatric center. So bariatric surgery is another big area that we have a focus on our Bryn Mawr campus, where we service not only our immediate Bryn Mawr and Mainline market, but throughout the region as well. We just actually added another surgeon to our mix there. So that's another area of focus for us. And also behavioral health. Behavioral health is an area, as we all know, has been impacted dramatically. Not even during the pandemic, but even pre-COVID as well. But we are in the process actually of doubling the size of our inpatient behavioral health unit, and also growing those services as well. So not only what's available on the Bryn Mawr Hospital campuses, but what is also available throughout the Mainline system as well. And then one that has a connection with what I think Brandon will be sharing a little bit later. We have what's called a unit that specializes in elder care, an ACE unit. So acute care for the elderly is what that stands for, ACE. So where that unit actually focuses on specialized care for our seniors. So just another attribute of services that we provide on our Bryn Mawr campuses and throughout Mainline Health.
Is this one of the reasons that the Bryn Mawr campus is expanding right now?
Well, I'm glad you asked that as well. So as you probably know, Bryn Mawr, we just completed a $300 million project with a new patient pavilion that opened in 2019. We're very excited that we can offer now all private rooms, for all of our patients that decide to come to us. But yes, it is one of the areas that we tried to focus on in terms of improving our infrastructure, so that is again more conducive. Now it's amazing sometimes in infrastructure how some of the rooms were kind of tight and you kind of compact things all into one space. But now with some of the equipment that's necessary in our OR areas, some of the equipment necessary, even in just your normal patient rooms, the patient pavilion has allowed us to definitely provide a much more comfortable and conducive environment as we care for our patients and our families. One of the big things that we like to focus on too is patient family-centered care. And so that's an area where we also even have a patient family advisory council of all former patients and or family members of former patients to help advise us and give us input on various topics that we're working on across our Bryn Mawr and Mainline campuses.
How has Mainline Health responded to the COVID-19 pandemic?
Oh, in a couple different ways. One of the things that we can say that we were able to do during the course of the time, we had to also not only assess our resources from a labor standpoint as well as supplies, but then also we made the decision, as did other healthcare institutions in our region as well, where we curtailed some of our elective procedures and services during the course of the pandemic. And so that allowed us not only to keep people safe, but also allowed us to focus our attention on our COVID patients and the care that our COVID patients needed during that time period. I mentioned, resource utilization, another big area of focus. You probably heard on the news just as well as anybody else, the impact of having protective equipment, what we call PPE during the course of the pandemic has been a big item for us and something that we spent a lot of time and focus on. And then as we communicated across our leadership and across our frontline employee base has been, I think, a mark of I would like to say, improvement for us this time, but also how we not only communicated within this organization, but hopefully those in the community felt that the communication that they received from Bryn Mawr and Mainline Health was one that was very helpful. So just some of the ways that we spent time focusing during the course of the pandemic and even now.
Can people get tested for COVID-19 and vaccinated at your hospitals now?
Yes, they can. Now, the COVID testing is available in a multitude of ways. So at Mainline today and at Bryn Mawr, we do COVID testing, but it is through your provider to have to get that prescribed to get testing. So we don't do walk-in COVID testing, but definitely through your provider, we would do so. And for the vaccine, we actually now have moved the availability of the vaccine to our urgent care centers. So we have 3 urgent cares, one at our Broomall location, one in Exton Square, and the third at our Concordville site. So available, we do have appointments on the schedule, but we're trying to make it as accessible and as easy as possible to do so.
I know that Mainline Health has had real interest in the issue of food security and food insecurity. Does it have a special relationship with ElderNet of Lower Merion and Narberth?
Yes, we do. And we've been partnering with ElderNet for quite some time. Very, very proud to say that we not only partner in, I think, some economical ways, but also partner through through our Ask a Nurse program, which is one that we're very proud of, that we've been hoping to expand, over time. And as well, also through the Resource Center and Food Pantry. Another area with ElderNet that we hope to, and Brandon will be talking about this even more, hope to grow that in terms of how we partner with their food pantry. I know a lot of our employees support it and donations and things of that nature, but through our work we do with Lankenau and also the Deaver Farm they have on the Lankenau campus, we are looking to expand it even further. And so just some of the few ways that we hope to continue to grow that.
Now, you mentioned the farm at Lankenau, and I understand that Lankenau doctors are able to prescribe fresh vegetables for patients. Is that true?
That is correct. That is correct. And so we started that through a grant. It was grant funded through our foundation at Lankenau. But the physicians do make a prescription for a patient that they've identified to be at risk or be in a food desert. And the Deaver Farm will provide them with a basket or box of fresh vegetables to go home with. Now, what we are doing, we're expanding that. So not just at Lankenau, but at Bryn Mawr, our Paoli campus is also doing it to a degree now, and something that we're going to continue to grow on.
Well, this has been fascinating. I unfortunately have to interrupt again because we have to take another break. We'll be right back with more on health services and health matters. Stay tuned. Welcome back to Health Matters, a show about health issues and interests facing our community. I'm your host, Gilda Kramer, Lower Merion Township Commissioner and Chair of our Health Committee. We've been talking about health services that are available to our residents, and now I'd like to learn more about what one of our own nonprofits that focuses on providing health-related services to our senior citizens, ElderNet does. Mr. Trombetta, can you tell me exactly what an ElderNet does?
Well, thank you very much for having us, Gilda. ElderNet provides a very basic range of services that help fill the gaps that arise as people age in place, services that you aren't able to find elsewhere. Our services are broken up into 4 different categories. Our volunteer services program provides free volunteer services to help people navigate their changing lifestyles. For example, if you lose the ability to drive, you're not able to go to the grocery store, the bank, the pharmacy, or the doctor, we have volunteers who will pick people up in their homes, take them to these different appointments, and bring them back home, making sure they get in safe and sound. We have some volunteers that will go in and provide some very light home maintenance, some odd jobs around the house to help make sure that somebody's home is safe and livable. And we also have volunteers who will go into people's homes and just spend time with them, fighting the effects of social isolation and the negative health outcomes that are associated with it. We have a care management program that provides 2 care navigators to the community free of charge to help people and their families navigate their changing lifestyles. They help with referrals for services, helping them traverse the often convoluted healthcare systems that arise as people age in place, but also just provide basic support to people and their families, making sure that they know they're not alone and that they will get through their challenges. We also have our Community Resource Center and Food Pantry that provides a choice food pantry to the community. It provides an Ask a Nurse program provided in partnership with Mainline Health, Bryn Mawr Hospital. We have a care navigator who is there to help people sign up for and maintain their public benefits. And we also have a very unique emergency financial assistance program that will help people with one-time payments for emergency financial constraints that show up, emergency bills, just to help them maintain their housing stability. And finally, we do have an information and referral system. Anyone, no matter where they're coming from, whether it be in the community or anywhere across the region, we get people to call us and ask us for help because they see what we do and they need that If we're able to help, we will help them. If we are not able to help them, we will provide them with the name and phone number, provide them referral options so they can find the resources they need somewhere in their community.
One of the really important services you provide is your food pantry. How has the pandemic affected food insecurity in our community?
Well, as with everything, we saw food insecurity rise in our community. ElderNet alone experienced a 33% increase in people utilizing our services. We were lucky enough to be connected with other systems, so we were able to receive some additional food resources, some additional donations to help balance that out, because as the need increased, the donations dropped off a little bit. So we were able to maintain our shelves fully stocked so that we could serve the community.
What makes food and financial insecurity a little different in our community, where most people wouldn't think that these are real big issues in Lower Merion?
I think a lot of it just comes down to perception. Whenever people think about food and financial insecurity, they think Philadelphia and Norristown, where you can see dilapidated or condemned homes, or just the effects of poverty along the street. Here in Lower Merion, poverty exists. It just looks different. You have people that have lived here their whole lives. They had a very successful life, but they may have lost everything they had saved for retirement in the stock market, and now they are using Social Security to try to survive. They could be living in the home that their family has owned for decades. However, the outside looks nice, but the inside is where the effects of financial insecurity are starting to be shown. So they do exist. It looks different, and for us to be able to fight the food and financial insecurity in the community, we just need to be vigilant and be mindful of people who may need some assistance, though it may not look like.
We have several food pantries in our community: the Narberth Community Food Bank, the Mitzvah Food Pantry, the Ardmore Food Pantry, and also Neighbors Helping Neighbors is involved with this issue as well. During the pandemic, how have the different organizations found new ways to work together?
Well, we've been very reliant upon each other for additional supports. One of the things that we were able to do is we were able to receive some HUD funding to replicate a national model that arose during the pandemic, where we would use HUD funding to purchase prepackaged meals from restaurants, supporting the business community, and then distribute them from our pantries, supporting people who were facing food insecurity. I can say that people really enjoyed this meal, this program, the meals that are provided. We went through one round of HUD funding, and we were lucky enough to be awarded a second round of HUD funding to continue this program into the future. It's just one way that we've started working together. We're also sharing some resources. I know that some of the pantries, whenever we do receive an abundance of of a donation of certain type, we will reach out to other food pantries in the area, just asking if they need any so that we can support each other through these times.
What do you see as the needs of our community as we begin to emerge from the pandemic? And how is ElderNet working to meet these needs?
I think that the needs of the community are on one hand, they're staying the same, where people need the basic supports to remain in their home. However, there's a shift now in fighting the social isolation, and I think there's an appetite in the community for the community at large to play a part in this. And I think that there are ways that we can come together as a community and create cross-generational opportunities to connect with each other and fight the effects of social isolation and keep people engaged in the community that they may have lived in for their entire life. We at ElderNet right now are working on different ways to achieve that, trying to find ways that we can create events or take some of our current programming and alter them a little bit so that we can provide a little bit more, or create new programming to address the unmet needs that don't fall into our current state of programming.
How can our residents help ElderNet help our seniors?
So all of our services, again, are free and they're volunteer-based. So if people want to help out, they can contact ElderNet. You can contact us at area code 525-0706, or you can email us at eldernetstaff@gmail.com. And just let us know that you're interested in getting involved in volunteering. We'll have our volunteer coordinator, Michelle Buller. She'll get in touch with you. And all of our volunteer opportunities are one-on-one. We don't have group opportunities, so it's a little bit different from what people would expect to go into a volunteer engagement. But it is really based on your schedule. We don't ask for people to sign up ahead of time for a certain number of hours a month or a week. It's really up to your schedule. So if somebody has a ride that they need and you have a 2-hour block in your schedule, you can connect with them online, claim the ride, and fill it that way. So if people do want to get involved and they do want to begin volunteering with ElderNet, please reach out, contact us, and we can certainly vet the different opportunities with you.
Well, thank you so much. That's unfortunately all the time we have for this month's show. And I want to thank my guests, Elizabeth DiArcangelo, Shaun, Essex, and Brandon Trombetta, for being here and sharing information about the important services that the county, Mainline Health, and ElderNet provide to our community. Thank you so much.